Hey, happy Friday, everyone. As you can see, my background is a little different today because I am doing this from sunny and warm Arizona. But I am super happy to have Angela Fishman with us. She is a physical therapist, but a very special kind of physical therapist. She focuses on pelvic health. Now, this is something that people don't normally discuss,
True.
but I know so many people that suffer with this. So I'm super happy to have Angela with us. Welcome.
Thank you so much for having me. I'm very excited to be here.
So tell us, what is a pelvic therapist? What is it that you do?
Well, so I'm a physical therapist first, but pelvic
Okay.
health is the area that I specialize in. So I treat patients that have any issues with pelvic floor muscles or anything really in the pelvis that has any kind of problem, such as urinary leakage, pelvic organ prolapse, pelvic pain, anything that has to do with the pelvis. I treat that area because there's muscles in that area.
Oh, that's now, who knew that? I mean, I guess we knew that, but we didn't think about, we think about physical therapy for every other muscle, but
Exactly.
we don't think about that. So do you want to tell us a little bit about how this works and
Sure.
how you help?
So the pelvic floor muscles work the same as any other set of muscles. So just like you might have muscles in your shoulder, maybe you've got a sore shoulder because you played ball over the weekend and it's hurting and there's muscle dysfunction there. You might go to a therapist to get some advice of how to get your motion back and how to get the muscles better. Well, the same kind of thing can happen in the pelvis. It's just that those muscles are in a different place, obviously. So we need specialized training to be able to treat those muscles as well as assess them. And because they're in the pelvis, they affect pretty personal parts of our body, right? So, like you were saying, a lot of people that have issues, but probably don't talk about it because it's quite embarrassing. So, a lot of issues with urinary urgency, frequency, leakage, getting up at night a lot to go. Um, Pelvic pain is
Really?
common.
So do you think getting up at night to go has something to do with it? I just always thought, well, I drank too much water during the day.
Yeah, I mean, it can. It can be simply that. If you get up occasionally at night, that's just within the regular norm. Or if you drink a big soda before you go to bed, you're going to get up to have to go. But if that's something that actually is interrupting your sleep, if you're getting up two or more times a night and it's actually disrupting, so your quality of sleep is poor, then that's something that we can look at. And there's a lot of things. That particular symptom can be caused by pelvic floor dysfunction, but can be caused by a lot of other things too. So sometimes we have to point people to the right direction. If we treat everything in the pelvis and everything is fine and you're still getting up at night, we need to look and see, is there a medical reason too? Because there's a lot of things that can cause that.
And you can do that. So, I mean, a person can start with you, and then if that doesn't work, you would direct them as to see.
Correct. If somebody comes to us, we do a really long first visit because it's a lot of talking, getting history, and we kind of know what to look for. If you haven't seen a physician at all, and we think you might have a bladder infection that could also cause some of those symptoms, of course, we're going to send you to a doctor right away. So we kind of screen out to see if you're appropriate to start therapy right away, or if you might need to see a specialist, because there's a lot of different specialists that can help in this area as well.
So, what's coming to mind right away is if someone has this issue, do they have to go and get a doctor's note to come and see you? Do they have to be referred, or how does that work?
Yeah, it's a great question because it differs. If you're going to go to private practice or like someone like myself in Illinois, we're a state that has direct access, and many states have this, where now you can directly go to a physical therapist just like you could another healthcare practitioner.
Okay.
If you're going to a hospital and seeing someone in a hospital, a therapist, then you're probably going to need a doctor's referral because that's how they have their policies set up. So it kind of depends on the setting that you get seen in.
Okay, but so you are in private practice. So if
I am.
somebody wants to, it would be just like going to see the orthopedist. Call
Exactly.
up,
Yes.
right, and make an appointment, and they can submit this to their insurance, correct?
Correct. So I don't take insurance. I don't do any of the insurance billing. But if anyone has like out of network coverage, then we assist them in submitting what they would need to help get coverage that way.
Okay, great. Um, so Is this just something that happens to everybody as they get older, or men? Does it happen to men? And
Yeah, so let's
how
start
does
with the men part first. So men definitely have pelvic floors. People are always stunned when I say that because men also just think, well, it's just women, they have babies, they leak, they have issues, don't talk about it. That's kind
right?
of as far as like a lot of society gets. But men have the same anatomy. It's just instead of 3 openings in their pelvic floor muscles, they only have 2, but they can have issues as well. So as far as how common and who gets it, issues with, for instance, stress incontinence and urge incontinence are probably 2 of the most common things. So leakage, urgency, frequency. And that definitely gets more common as we age, more common after you have kids, more common after you go through menopause. So there it's more common, but it is never normal. So normal is not the same as common. So yes, you'll see it much more as people age, but it is not a common it's not a normal thing. Definitely common, but not normal. And
Okay,
men
so
same way. Men tend to have those issues like as they have start to have prostate issues, or if they've had a real common thing that we see is leakage after prostate surgery. That tends to be when there are symptoms hidden.
so if they have prostate surgery, or
Mhm.
if you are older and been through menopause, I think we just figure, this is just me, but maybe there's a lot of people like me who just figure, well, it's part of getting old, so forget it.
Right.
So I'm sort of hearing that's not true.
It's not true, and it's not good to ignore it because it does not tend to get better with age. It tends to worsen, and so it's much easier to treat something when you nip it in the bud. So if you've got some leakage issues or you've got some bladder issues that really affect the quality of your life, you wanna jump in and take action because it's much easier on the early side versus waiting 20 years and then it's really bad. And now our options are a little more limited because it's hard to kind of go backtrack all the way and get your muscles back to where they need to be. And it's not just the muscles, it's a lot of behavioral things too that you need to learn to handle it.
Like what? I mean, can you give us an example of a behavioral thing?
Absolutely. So if you're someone who drinks 4 or 5 cups of coffee a day and have bladder frequency, urgency, and leakage, one of the first painful discussions we're going to have is okay, we need to look at that habit of drinking because that's a potential irritant to your bladder and a very common irritant, and it can feed into all those poor patterns. Or you might be somebody who does what we call just in case toileting, meaning I'm going to run to the store, but let me go just in case because you don't want to have any discomfort outside of the house. And you go more and more and more often, and that can build into this urgency and frequency pattern. So things like that, we do a lot of counseling of how to adjust some of those behaviors to make it much easier to get bladder control back.
That's great. I was having a really good day until I just realized I might have to stop drinking so much coffee. It was my one
I mean,
guilty
there's
pleasure.
plenty of people that might be able to drink that much coffee and never have a problem. So it's not like an absolute. But if someone comes to me with a problem and they're drinking that much coffee, that's going to be one of the first conversations we're going to have. Yeah.
I love that. I love that. So there are behavioral and then there are exercises, right? That we
Hmm.
can.
Yep. And then if you
And
know, if we, yes, there are other medical things to do too, but first line therapy, especially for bladder issues, is pelvic therapy because that has very obviously the side effects are extremely low and it's very effective. So the first line therapy is physical therapy. There are some occupational therapists that treat in this area as well. And then from there, if we feel like you're not progressing the way we think you need to, then we'll pull a healthcare practitioner in and see what we need to do.
you know, tell us a little bit about your background. You told me that you started in the hospital. Is that correct?
I did. Yeah. Yeah.
Yeah. So just so people understand, you didn't just dream this up as like a therapy to do
No.
for people, but this was, people are often treated for this in the hospital. Is that correct?
Yes, and I worked in a hospital. I worked at Lutheran General in Park Ridge for a long time, and they have urogynecologists there, as well as a
Okay.
lot of gynecologists, obviously. And those tend to be our biggest referral sources because that
Okay.
tends to be who you go to see if you're having problems in this arena. So we had a very steady flow of patients with these issues, which was great because that's how you learn. I mean, you can learn from a book and learn in a class, but when you learn with actual people and actual situations and stressors, stress plays a part in how our bladder works.
Right.
So you start to learn some of the tricks of the trade. to help them reach what their goals are. So it
Right.
was a
So
great place to learn the trade for sure.
and now you can reach so many more people because people can just make an appointment with you. They don't have to be a patient at Lutheran General or
Exactly.
referred by a Lutheran
Exactly.
doctor. So that's really great.
And that,
Um, Tell me about your challenge.
yeah, so I was
Let's
just
talk
going to
about the
say, and
challenge.
that's one of the reasons I really wanted to go to telehealth, because a lot of people in rural areas there's not a lot of pelvic floor therapists. There's a lot in the
Right.
Chicagoland area because we're such a big area, but there's really not, once you get rural, there's not very many pelvic floor therapists or specialists. So that's one of the reasons I went to telehealth, and I've gotten licensed in 4 states, so I can reach more people.
Which
But what
other
I really
states?
wanted to do is reach more people, but also guide them. And I came up with an idea of a fitness challenge that is really more focused on strengthening and making a resilient pelvic floor so that when you leak with coughing or sneezing, you can learn all the different things that will help you not do that, but we can do that as a group. So I'm
Okay.
really excited. I just filled up my first class, and we're starting on February 21st. It's a 6-week class, and it's got a live Zoom portion as well as an online course portion, and we'll see how we do in 6 weeks. Everyone in the class, I'm hoping we'll see a significant improvement. So yeah, I'm very
That is very exciting because you're going to get a lot of data and help a lot of people
exactly.
learn a lot
I hope.
and get the word out. That is really exciting. Well, I'm very anxious to hear how that goes.
Yes, I'll definitely let you know.
Yes. So, what other states are you licensed in? Just so anybody, because
Yeah,
you know.
I'm licensed in Colorado and
Oh,
California, and can also see patients in Florida.
oh,
So
all the great states.
yeah, well, the ones
California.
that I like it, I'm at
Right, right. Well, as a Compass agent, we have connections that I have dear friends across the country. And I know some of them are watching now out in
terrific.
California. So it is great to know that you are licensed in California, Colorado. And of course, my family lives in Florida, so that works. So
Well, and a lot of people go to Florida for the winter, so that's helpful too. You have to be in the state where your practitioner's licensed. So you could be from Colorado or you could be from Tennessee, but if you're in Florida, when you contact me, I can treat you while you're in Florida. So that's kind of how the licensing works.
that's great. That's great. Well, you're going to have to get licensed in Arizona because a lot of Chicagoans go to Arizona.
That
So
might be the next one. Yeah.
I think that should be the next one, judging from where I know people are going. So,
Yes, definitely.
so I want to thank you so much for being with me today. And I want to let everybody know that on my website, Betsy Phillips Realtor, your information is there. This video is there. If anybody wants to share it with anybody, please do. Angela's email address and website are also there. So you can contact her directly. And I just want to thank you for enlightening all of us.
Oh, my pleasure. Thanks so much, Betsy, for inviting me. I really appreciate it.
Yes. So and we're going to catch up with you in about 8 weeks and find out how the
Yes, let's
challenge
do
went.
that. Fingers crossed.
Yes, it's going to be great. All right, everybody have a great weekend.
You too.
Enjoy the weather.
Bye, Betsy. Thank you.
Bye bye. Thank you.